the country has collapsed. The COVID pandemic has added to those a very big problem that we believe will only get worse. If the situation in the whole country is so bad in the north, and especially in Tripoli, it's much worse. It's due to many factors. As you know, Tripoli is considered as the poorest city on the Mediterranean. We have a high percentage of unemployment. It's around 60 to 70% actually. An unemployed person, it's a whole family without medical coverage, without income, without education. So the COVID pandemic we're facing actually started exactly 1 year ago. We've suffered for many problems. We had many lockdowns, some partial, other complete, but it was not respected in Tripoli. It's due to the poor economic situation. People has to work on a daily basis to get their money. They have choices to die from either hunger or COVID.
How has this political uncertainty and the financial ruin that is facing Lebanon specifically impacted the health system and your hospital? Tell me what's going on in your hospital on a day-to-day basis. How are you coping?
We have many problems. As I told you, the main problem is the lack of medical teams. Every day, we have a large number of our doctors leaving the countries. We don't have enough nurses to keep on a daily basis with the activity we're facing with a large number of COVID patients. We have a daily problem to cope with all these lack of equipment, medicines, gas, oil, maybe personal equipment. It's really a hard problem to deal with.
Dr. Nusreen, the World Bank has spent $34 million to fund Lebanon's COVID-19 vaccine drive on the condition that doses would go to the most vulnerable groups first. Now, lawmakers in Lebanon breached that deal by jumping the vaccine queue. In response, the World Bank's regional director has threatened to withdraw the funding. This suggests that corruption and nepotism continues through the vaccine rollout. Just how is that impacting on Lebanon, on those who clearly need and should get these vaccines at present?
My dear, violation, it's a normal, it's actually a fact that we're accustomed to in our daily activity in Lebanon. It's not the only violation we have. For the vaccination, there's many problems we're facing actually. Do you imagine that we don't have enough vaccine for the medical staff? We started our vaccination 3 weeks ago, and until now, our medical staff is not completely vaccinated. Our frontliners are not completely vaccinated. So we have a lot of problems. We've started, but without the implication of the private sectors, I don't think we can manage this big problem.